People might not want to think about, which is going to the bathroom. If someone sees blood or has weird changes when they go, is just this normal, or could it be something more serious?
Blood in stools, the commonest condition that we see in clinical practice would be piles. Piles is a very common terminology. But the worrying fact is when it's been persistent, when it is associated with abdominal cramps, loss of weight, loss of appetite, and the bleeding has been persistent. Blood from the end part of the large intestine, it doesn't take away his life. But the serious problems would be inflammatory bowel disease or polyposis coli or the colorectal cancers. The former two conditions can lead to this.
Welcome to Health Inside Out, a Kauvery Podcast.
Alright, Shan here on Fever 104 FM. The show is called The Superhero Show, and on the show today, it's time for Health Waits from Kauvery Hospital, Marathahalli. In the studio, I'm joined by Dr. Raghavendra from Kauvery Hospital, Marathahalli. Sir, first of all, thank you so much for taking time out of your, I'm guessing, extremely busy schedule and coming to our radio station.
Thank you. Thanks for the welcome.
Even before the interview started, I was peppering you with a lot of questions, and then I realized you might be tired of answering all these questions.
No. We get used to answering such questions. Nowadays, staying in this part of city, we have many Google degree holders. Yes, we get to answer them all.
Okay, I've got a set of questions for you today. We will talk about something that is plaguing a lot of people. But before that, if you could kindly introduce yourself a little bit for our listeners, sir.
Hi, I am Dr. Raghavendra Nagaraja. I practice gastroenterology, surgical gastroenterology. So, practicing at Kauvery Hospital, Marathahalli.
All right. Let us talk about stomach problems, right? A lot of us blame our stomach problems on something we ate. But when does bloating, cramps, or let's say bathroom troubles become something we should be worried about?
Yes, in the short run, probably the problems that you face is due to the food that we eat in the short run. There's a saying, you are what you eat. But in the long run, if it is becoming too recurrent, or if it's been persistent, say beyond 2-4 weeks, or if it's been recurrent, say 2-3 times in a month, then is the problem that we should think of and we should seek a medical help. Particularly so when we have warning signals. What are the warning signals? Loss of appetite, loss of weight, unintended weight loss, not the intended one. Loss of appetite, loss of weight, or developing jaundice, or change in the stool habits. Say for example, earlier you were passing once a day, now suddenly it has become 3-4 times a day. Earlier it was solid stool, now it's semi-solid or liquid stool. You have blood in stools. You have other problems like jaundice. Then it's a major problem that we need to seek medical attention.
All right. Most people think that they can just change their diet, or let's say just pop a pill. You go to the local medical store and ask them for a pill, and that will fix their stomach troubles. When do you know it's time to stop self-treating and go see a specialist?
When those tablets do not work, that's the time that you should seek that. In the first go, over the counter seeking pills for symptomatic relief has been running along for quite some time. It's okay as long as it's short run, once or twice in a year probably, that's perfectly fine. But it's been recurrent, you have warning signals, or it's been persistent, I think that's the time you should seek medical attention.
I just realized that for most of us Indians, there is a level of people that you meet first and then you can go to the doctor. So first is you have your family members. Those are your first doctors. The second level of doctor is the guy who sits in the medical shop. And then the actual doctor comes.
And then the actual doctor comes, whatever he prescribes has to go through the scrutiny of these doctors. That is all the difficulty.
That is also there. Okay, let's talk about something people might not want to think about, which is going to the bathroom. If someone sees, you just mentioned that, if there is blood in the stool, if someone sees blood or has weird changes when they go, is just this normal, or could it be something more serious?
People coming with blood in stools is very common, and the commonest condition that we see in clinical practice would be piles.
Okay.
Piles is a very common terminology. But the worrying fact is when it's been persistent, when it is associated with abdominal cramps, loss of weight, loss of appetite, and the bleeding has been persistent. Blood from the end part of the large intestine that is due to piles is really not bothersome, in the sense it may be discomforting to the patient or frightening to him, but it doesn't take away his life.
Okay.
But the serious problems would be inflammatory bowel disease or polyposis coli or the colorectal cancers. The former two conditions can lead to this. That's what one should be worried about, and our evaluation when such patients come is to exclude these possibilities. If it is only the piles, then we are not really worried about. We can treat them either medically or surgically. That is not really a problem. But if they have all these problems, they should undergo a thorough evaluation by colonoscopy, stool tests, blood tests, and probably even CT scans to exclude the possibility of more dangerous conditions.
Okay, so let's say somebody comes to you, sir, and the person says that I have persistent stomach issues, not something, let's say not the warning signals like blood and stool and stuff like that, right? Let's say somebody says I have persistent, once in a while my stomach goes for a toss, it stays for a day and then comes back to normal. And that happens once a month or once or twice a month and stuff like that. What kind of tests will they have to go through, let's say?
Yes, many of the healthy people do come with such symptoms. We call something called irritable bowel syndrome,
Okay.
which is much more common in clinical practice than the inflammatory bowel disease, fortunately.
Okay.
And it's not dangerous.
Okay.
What we do is we get at least one cross-sectional study. Cross-sectional study means imaging, either ultrasound scan or CT scan, depending on the severity of symptoms. Endoscopy and colonoscopy and/or colonoscopy, depending on whichever system we believe is more involved. So, and the basic blood tests, which includes blood counts, kidney functions and liver functions, if these are normal, then they should not be worried about. And we treat them symptomatically, keeping in mind that they have irritable bowel syndrome or the functional GI disorders.
Okay. Okay. There is a term that scares a lot of us, and that is colonoscopy. How important are screenings for things like colon cancer and other gut problems? What can people expect if they come in for a colonoscopy?
In India, we don't have definite set guidelines for getting a screening colonoscopy done. Say for example in United States or Japan, they have set guidelines. Beyond 60, get a screening colonoscopy. Screening colonoscopies, they don't have any symptoms, but we do the colonoscopy. In people who have family history of colorectal cancer or who have the conditions I told before, inflammatory bowel disease, either ulcerative colitis or Crohn's disease or adenomatous polyposis, they need to get the screening colonoscopy done, which starts at least 35 to 40 years or at least 10 years before the family member, whoever has got the colorectal cancer. Say for example, if someone has got it 40 years, I think we need to screen the family members at 30 years.
Okay.
That is the time that we can pick up the tumor or cancer at a very early stage with which we can cure them. So colonoscopy nobody should be worried about, because nowadays most of them will be done under either sedation or anesthesia. So there's not even discomforting. Earlier we used to get it done even with conscious this thing. So they were not even being sedated. At the most they would feel some abdominal distension or some pain, which usually comes down once they pass the gas. To see the colon, we inflate it. So inflation or distension of the colon causes that stretching, discomfort or pain. So once they pass the gas, they are relieved of that.
Okay, so for those of people who have serious gut issues like Crohn's or colitis, surgery sounds scary, but when does surgery become the best option? And all of these, the Crohn's or colitis, does it always require surgery for that matter?
Not always. Inflammatory bowel disease, it's of two types. One is Crohn's, one is ulcerative colitis.
Okay.
Good thing about ulcerative colitis is it involves only the colon.
Okay.
So although there is no curative medical treatment, there is always a curative surgical treatment. It involves a major surgery, take out the whole of colon and rectum. So patient would have a permanent stoma. ileostomy over the abdomen through which they would pass the stool. So they will not have anything beyond that, but it's curative. It cures ulcerative colitis. People with such severe disease, they're usually happy accepting the stoma than having their colon. Patients with less minor diseases, they have this inhibitions. Should I need, should I not need? Crohn's disease can involve any part of the GI tract. And no surgery is curative for Crohn's disease. And they can
When you say curative, that means no surgery can absolutely cure.
No surgery can absolutely cure Crohn's disease, but it can cure ulcerative colitis.
Okay.
We rarely come for surgery in Crohn's disease only for complications, like the intestine gets blocked, obstructed, or there is a fistulizing disease. Then only, or there is suspicion of cancer, then only we think of surgery in Crohn's disease. But ulcerative colitis, when patients are not responding for the routine treatment, or when the dose is reduced, the disease relapses, or when there is suspicion of cancer, or when there is infection, or major complications like megacolon, we will need surgery. But at least we should be happy that in ulcerative colitis, it is still curative. But most of the times, symptom severity or the disease severity or the symptoms can be kept at bay with medical treatment, optimal medical treatment.
Okay. Lot of people think surgeries mean long recoveries. We've talked quite a bit about surgeries. So long recoveries and complications is what people expect when we talk about surgery. Can you talk about how new surgeries for gut issues are quicker and easier to recover from?
We have had, unfortunately we don't have a newer surgery for now. Yes, we are doing it minimal access way, in the sense earlier what we used to do by open surgery, we can do it either laparoscopy or by the robotic way. We remove the whole of colon. And there is something called enhanced recovery after surgery, ERAS protocols. They don't need to be on bed rest for very long time. We make them come out of bed or mobilize on either day 0 or day 1. They'll start on oral feeds depending on the intestinal recovery, which is usually by day 1, day 2 they'll be on some liquids at least. So with these, there is not much time lost, in the sense they won't be bedridden. Unless they are very sick to begin with, they won't be bedridden. Most of them would be back to work by 10 to 14 days. And one of complication would be there, but that should not cause any major problem.
Okay. In terms of gut health, what are the foods that you think everybody should include in their daily habit? I mean, of course, leafy greens.
Yeah,
that's definitely there. But apart from that, is there anything else that you would suggest to people?
If you take enough fiber in the diet, yes, it will take care of the constipation or the regular stool or the bloating problems. If we don't take enough fiber-rich diet, then we have to resort to the alternative medicinal fiber, which I wouldn't suggest to begin with. But if something is not helping, then probably we may have to depend on it.
Okay.
Along with that, a balanced diet which includes both major macronutrients or micronutrients, enough carbohydrates, proteins. The problem with our South Indian diet is, particularly vegetarian, it's predominantly carbohydrates.
Yeah, right.
It's rice, not much of fiber, not much of protein. That is a bit worrisome. We need to have enough fiber-rich diet, enough vegetable, enough fruits, then probably a modest carbohydrate and protein source. This should solve most of our problems, not just the gas.
Carbohydrates is the most tastiest.
Yeah, I know, but that's the most problematic also. Not just for the gut, it is for the liver or pancreas, for anything.
Actually, gut is something that most of us don't understand. People who are not doctors, we don't understand. We know for particular gut health has to be good, but how does gut health influence our health? We are not too sure about that. Like, I hear that you should eat curd or something. When your stomach goes for a toss, you eat curd because that is beneficial for your gut bacteria.
Yeah, probiotic. It's a probiotic.
Yeah. But we don't have an exact understanding of how to, keep your gut bacteria in a good health, for that matter.
In the sense, for example, after any gut infection, the colonic bacteria, it gets changed.
Okay.
To replace it back, we use probiotics or ask them to take curd or similar things. But not everybody can take it. For example, some people are lactose intolerant. Some people cannot take those milk and milk products. In them, we again have a problem. So it's a mix and match basically. We need to take help of medicines also. We need to take help of the natural resources also.
All right. For people who take a lot of these health supplements, how do they affect, like I don't know, stomach portion of our body? Let's say protein shake and, all that we probably use in the gym. Let's say BCAA and stuff like that.
I'm not an expert on this. I'm not a nutritional expert, but nonetheless, I wouldn't suggest those health supplements.
Oh, okay.
If you take natural diet, balanced diet, that should take care of everything. Unless you're into muscle building, you may need extra protein, which also is available in a natural way. If you're a vegetarian, either sprouted legumes or soybean or groundnuts. If it's non-vegetarian, there is plenty of it. So
it's possible to have that just from food itself.
Instead of resorting to those supplements, I think better is to have it the natural way.
Okay. Finally, Doc, for anyone listening who's been dealing with stomach issues for a while but has not gotten it checked out because it has not gotten to a portion where they should get it checked out, what's your advice? When is it time to take action? Though you covered that part.
Yeah, if it's been persistent or recurrent or you have warning signals, either family, it can be family history, it can be loss of weight, loss of appetite, or notice blood in stool, or the symptoms have been very persistent, recurrent, I think that's time you should seek medical attention.
All right, Dr. Raghavendra, thank you so much for coming to the studio. Thank you so much for spending this time with us. Your
Thank you, Shine.
information that you put out will be helpful for a lot of us. We are Indians, we all have a little bit of stomach trouble here and there.
Yeah.
So that information will be beneficial. Thank you so much. You have a busy day ahead of you, sir.
Yeah, I still have.
All right. Okay, I'll let you get back to it. Thank you so much for talking to us. That was Health Waves from Kauvery Hospital, Marathahalli. Shine here on the Superhero Show. Much more coming up. Stay tuned.